Dr. Schultz here with Functional Spine and Sport. I have a patient of mine who was willing to share some of his experiences with our office, and what he was talking about to my staff a couple weeks ago was really powerful, and I wanted him to share that with all our viewers out there. So what he was talking about was kind of the insurance side of things, which you can hear from us and from our staff so many times, but it's even more powerful hearing it from someone who's experienced and lived it. So I'd like you to share that with everyone.
Sure. I think I'll even go even further back when I first learned about functional spine and sport. Probably 2 or 3 years ago, my wife and I noticed a Facebook post and kind of showing how you basically help people by going into the soft tissues and making things feel better. And it looked like it made sense. And I'd been going for years to acupuncture, you name it, doctors prescribed tons of medicines. I tried everything, and I've been dealing with pain I'm going for about 15 years of my life now, after car accidents and growing up on motorcycles and dirt bikes and crashing and sports injuries, and basically just a lot of pain. And it had really gotten to the spot where I could not function as good as I know I could if I felt better. So I finally took the risk of coming to Dr. Schultz and letting them examine me, and we did a full MRI on both my neck and back, because I have problems everywhere, not just isolated to one spot, but my whole neck, back, spine, all of it is really in bad shape, or was. And fortunately, because of the MRI, we were able to locate the problem areas, and fortunately I was in a financial spot where I knew I could try to take this on and give it a try. And I did submit the claim to my insurance, and of course they did deny it. And I went into this whole thing knowing that that was probably going to be the result, that for some reason insurance companies don't cover soft tissue therapy, which is a shame, because here I am 15 years later with no pain. I'm waking up every morning now, no pain. I feel great. And yeah, you need to realize that just because insurance won't cover this doesn't mean you shouldn't explore this as something that you should try. Yeah. Period. Yeah. So it's worth it. You just need to figure out financially how you can adjust it, but start adding up all the bills of your acupuncture or your back doctors and all the time that you're spending trying to fix things, but it's not really fixing things. It's buying you maybe a week, maybe 2 weeks. In my case, it went from, I'd probably get 3 weeks of relief, and not the kind of relief I've got now, but just relief in general, and then have to go back and do it again, or take medicines like acetaminophen and things that start to mess with your liver or your internal organs. And I'm off of all that now. I don't need acupuncture therapy anymore at $85 a session. So yeah, it was a large upfront expense for me, and they do have options for you to look at for financing this. You gotta give it a try. If everything else fails, try this, and I would bet money that you will find that this gives you the relief you're looking for.
Yeah, I appreciate it. It's been a joy working on you and helping you out and really helping you manage just your day-to-day stuff, because you're a busy guy and you're in the car a lot, you travel a lot,
all the time.
and that stuff was really starting to affect you and starting to cause a lot of pain for you. So the fact that you can do your job without pain is massive. And now we're going to start talking about, or getting you to exercise again and getting you just a little more active in general. So it's been amazing seeing the progress you've made and the small stuff, waking up without pain.
Yeah.
None of that nerve pain down your low back again. Your neck's doing great. You're not getting tingling in your hands anymore.
Right,
So
you got rid of a lot of symptoms that were really starting to scare me.
Yeah, yeah, and when you think about it, it all goes back to your diagnosis, right? If you don't have a complete and accurate diagnosis, any treatment you have before that is just going to be haphazard at best. And like you said, you had temporary relief, 3 weeks at a time, sometimes a day at a time. So now it's let's see how far we can push it and see how far you can really make it without symptoms, without pain. So yeah, I love that. And your case was one you know, with your neck and your back, that it was a lot of work that we had to do, but you followed directions, and you're a rock star now. I mean,
I feel much better.
It's awesome.
And I guess, you know, when I saw how quickly, so you come in for these 15-minute appointments, and when it almost is something it's hard for me to accept. You know, I'm going to come in here for 15 minutes, I'm going to leave, and I'm going to feel better. Well, that's what happens. These little, small, incremental 15-minute sessions add up to a huge relief in pain. So you'll feel like you might not be spending the kind of time you should with a doctor, but it's different. I guess that's the only way I can explain it. This is totally different than anything I've ever tried, or anything that you'll try if you decide to give this a chance.
Yeah, and I think it goes back to us taking up a lot of time on the front end, you know, with the consultation and the exam, and making sure we get the diagnosis right, so we know with, you know, extreme clarity what we have to do for you going forward. So when you think about it like that, we spent, you know, a lot of time on the front end just to make sure the treatment's going to be successful for you. And then when it is coming down to treatment, we're extremely, you know, precise with it. We don't waste our time with any unnecessary treatments. We just go in, get the adhesion out, get the nerve entrapment out, get your body to move better. Right. And that's all you need is, you know, about 15 minutes of just focused work.
And it's to the point of where you know exactly where you're going, you know, and I think that's what the amazing part of this whole thing is that you know exactly where you're going to relieve that pain for that session, and then you move deeper, and then you move a little deeper than that. And before you know it, it works. So it works.
Yeah. So, you know, what's one thing that you're happy that you can do again that you were struggling with before, or just, you know, having a tough time with?
Just life in general. I mean, waking up every morning in pain, wondering how soon you're going to get relief. Sometimes it wouldn't go away, or working trade shows for work, or making sales calls. You know, like when you're dealing with pain and you're trying to sell your product to a customer, it's affecting your ability to perform.
Absolutely.
You know, so to have this off of my plate and to be able to focus on what I do best, you know, it's just a game changer. It's a game changer.
Yeah, absolutely. And a lot of people get stuck in the position you were in, where they're just living with the pain, or just trying to put a Band-Aid on it and keep doing their thing. And, you know, before you know it, 15 years later, you're at the end of a road, a very long road. But, you know, we got to the bottom of everything, and I literally couldn't be happier with how your case has gone. And this is the power of adhesion and nerve entrapment, is when you have that, like you had it, and it's just compressing everything in your spine and causing those degenerative things to get worse, it just snowballs and compounds on itself. So the fact that we got all that stuff pretty much out of you now, you're moving a ton better, you're healthier, you're out of pain, you can work your butt off now and travel across the country and do what you need to do to provide for yourself and for your family. So
exactly.
Yeah, it's just
I appreciate it.
Yeah, of course. Appreciate your time. Thanks for coming in.
Thank you.